For the second video, I will be taking a deeper dive into the integrative case that was presented in video number 1, involving workout buddies Josh and Brian. The case video mentions that Brian hates doing incline press and he hates chest day in general. This is because Brian suffers from what is known as Poland syndrome. Now, Poland syndrome is the abnormal development leading to missing parts of pectoralis major, chest wall muscles, as well as underdeveloped shoulders, rib cage, and sternum. These conditions come in a spectrum and can vary in how severe they are. Brian specifically was missing parts of his pectoralis major muscle, as well as some chest wall muscles such as the intercostals. Some symptoms of this include abnormal elevation and/or underdevelopment of the shoulder blade, as well as limited movements of the arm. This makes sense that Brian hates this day because he is missing part of the pectoralis major muscle, making it more difficult to lift heavier weights. This causes him to have to compensate with similarly functioning muscles in the area. Some other symptoms may include underdevelopment of the hands, such as brachydactylio, which is short fingers, as well as syndactylio, which is webbing of the fingers. And I also mentioned that he was missing part of his intercostals. This may lead to some breathing problems. A healthy individual would have a pectoralis major muscle that attaches or originates from the clavicle, sternum, and costal cartilage and inserts onto the anterior humerus. Due to its fiber orientation, this muscle is involved with arm adduction, internal rotation, as well as arm flexion. It's also worth noting that this muscle is innervated by the lateral and medial pectoral nerves, requiring you to review some of your brachial plexus. This condition is due to disruption of the formation of the subclavian and vertebral arteries during the 6th week of development. This makes sense as it's the vessels in a sequence following the subclavian artery, which would lead to a poor development of the thoracoacromial artery, which supplies these muscles, leading it to be malformed. It's also worth noting that these arteries arise from the right fourth aortic arch during development. Shifting gears here to a more physiological approach, the first video mentioned that Josh was fueled by both ego and creatine, both very powerful substances. The creatine referred to in this video is in the form of what is known as creatine phosphate or phosphocreatine, a common supplement for people that are working out. The purpose of taking creatine is primarily for energy in the context of ATP storage. This supplement works to increase the storage of energy in the form of ATP in our body. And with more ATP, your body has better performance, which is the reason why bodybuilders will take this to gain muscle, enhance strength, and improve performance. The mechanism of phosphocreatine is shown here. It centers around an enzyme known as creatine kinase, which catalyzes both the forward and reverse reaction. In the forward reaction, we have creatine attached with a phosphate, which will then catalyze ADP to form ATP, thus increasing our storages. However, it can also do the reverse in that it could take a phosphate away from an ATP to replenish that creatine phosphate store. The cases also mentioned that Josh underwent an X-ray as well as a CT due to his injuries upon arriving at the hospital. The X-ray, as shown here, is labeled. To orient you, the dotted lines are where the ribs are posteriorly articulating with the vertebrae, and the solid lines are where they're anteriorly articulating with the sternum. So remember, they sort of have that bucket handle appearance in which they kind of travel a little bit inferiorly and anteriorly. The vertebrae are also labeled as shown there, and the ribs are named for those vertebrae. And on the right side of the picture, or the left side of the patient's body, the red circles will indicate where the broken bones are. It's also worth noting that the radiograph shows somewhat of a leftward shift here. This is due to that hemithorax that Josh had suffered, pushing the viscera leftward. The CT further shows this leftward shift as there is some fluid accumulation in that right pleural cavity that we spoke of. And so as we go from superior to inferiorly here, we can see that fluid accumulation. But it is also noticeably absent on the left side as we progress. To further label some structures as we go superior to inferior here, this is that hemithorax that I spoke of earlier. And so the level that we're at here is we could see somewhat of our descending aorta as well as what would be our aortic valve. It'll be arching over our pulmonary trunk as shown here as we go towards our pulmonary arteries to receive oxygenated blood from our lungs. A little bit further down, we'll see the outline of what would be our heart and still maintain that hemithorax as shown here. And a little bit further down, we'll notice some fluid accumulation as well as the protrusion of that right hemidiaphragm. It's worth noting that this is absent on the left side, and that is due to the fact that the liver is pushing up on that right hemidiaphragm, causing it to be raised higher. Earlier, I had mentioned that there was fluid accumulation with what is known as the pleural cavity. And so the lungs are located within this thoracic cavity that are lined with a serous membrane on the lung surface, which is known as the visceral pleura, as well as the wall of the thoracic cage, which is the parietal pleura, as shown here. So these pleuras will reflect upon each other across the lung hilums. So they are one continuous sheet, creating somewhat of a closed cavity. And so for the parietal pleura, there are kind of three different segments of it. As shown in the orange is the diaphragmatic pleura sitting atop the diaphragm. Then we have our costal shown in yellow here, which is lining across the inner surface of the ribs, as well as the mediastinal pleura, which is going more towards that mediastinal cavity that we talked about earlier. And so these pleura create what is known as recesses, which is kind of where they're reflecting upon each other. And the most important one for this case would be this costodiaphragmatic recess. So it's important to note that these pleura create somewhat of a closed cavity that encases the lungs, allowing them to expand and deflate within. And this is where that fluid accumulated in Josh's cases. The pleura also have an importance of creating what is known as a negative pressure difference between both the lungs and the thoracic cavity. And so as the diaphragm contracts and flattens, the volume within the thoracic cavity will increase. This is then decreasing the pressure that is pushing on the lungs. The lungs will then want to fill this space and equalize with that pressure, causing them to fill in during inhalation. In the case of expiration, the diaphragm relaxes and returns to a dome shape. This decreases the volume within the thoracic cavity and increases the pressure pushing on the lungs, leading to expiration of that inhaled air. In the region of a fracture, in Josh's cases in his rib, this image is showing another bone, but it's still applicable. Blood vessels supplying the bone are ruptured and tend to form what is known as a hematoma around the fracture. Fibroblasts, chondroblasts, as well as osteoblasts are recruited to this area and will begin to form a mass known as a callus. The callus is essentially a collagen-rich fibrocartilaginous network, and it acts to stabilize the fracture and act as a scaffold to lay down the new bone. While it is in this scaffold formation, it cannot bear any weight. Within the callus, osteoblasts and osteoclasts will then continually remodel the bone by a resorption by osteoclasts and new bone formation by osteoblasts, replacing that callus edge, which is primarily cartilage and collagen, with lamellar bone. This entire process is known as endochondral ossification, in which cartilage is converted to bone. Some histology here. This is that lamellar bone that I spoke of earlier. Lamellar bone is mature bone that is laid down in sheets, and it is found within an orderly arrangement. A common feature of it is these osteocytes that are found within the lamellar bone in what is known as lacunae, and these will span throughout. Next part of the bone is this spongy bone, as shown here. This is where bone marrow is contained, as well as adipocytes. The purpose of spongy bone is for both storage of bone marrow, as well as helping make the bone less dense. If it were filled all the way through, bones would be incredibly heavy. The osteocytes that I mentioned earlier are found within the lamellar bone, and these get trapped during ossification. Their purpose is to maintain bone growth from within because these are actually trapped osteoblasts. Osteoblasts are the cells that will secrete osteoid, which is just the beginning of the formation of new bone. The osteoid can be seen here. And there's two forms of osteoblasts. There's these osteoblasts here, which you can see are a little bit flat. These are inactive or bone lining, whereas the ones that are a little bit expanded here with the accompanying osteoid are very active and they're depositing that new bone. On the opposite side, we could see osteoclasts. These are multinucleated cells that are breaking down and resorbing that bone for purposes of remodeling. During his incline press, Josh felt pain in his anterior shoulder that had radiated down his anterior arm. He originally thought that he was tearing his pec major muscle, but the doctor confirmed that this was a biceps tendonitis, which is caused by repetitive overhead motions such as the one Josh was doing. This particular injury occurs in the tendon of the biceps brachii long head. This muscle originates from the supraglenoid tubercle and spans down to the radial tuberosity. Similarly, the short head begins from the coracoid process of the scapula and spans down to the radial tuberosity of the radius as well. Because this muscle, the long head of the biceps brachii, crosses the glenohumeral joint, this muscle can be involved with abduction in the arm away from the body, as seen in the movements. This tendon travels superiorly through the bicipital groove found between the greater and lesser tubercle of the humerus, and then attaches onto the supraglenoid tubercle. A transhumeral ligament crosses the greater and lesser tubercle and holds this tendon in place. Swelling of that biceps tendon sheath may push on that ligament. During his checkup, the doctor conducted an MRI of Josh's bicipital groove, and I noted that there was swelling and fluid accumulation within the tendon sheath. The tendon can be shown here as it runs superiorly towards that supraglenoid tubercle. Breaking down some segments of the video that was just shown and going from superior to inferiorly, we can see here that we have the head of our humerus, as well as that supraglenoid tubercle that we spoke of earlier. A little bit more inferiorly, we can see that bicipital groove highlighted in purple containing that tendon, as well as the greater tubercle of the humerus and the lesser tubercle of the humerus that outlines it. And then a little bit more inferiorly, we can see just the biceps tendon for the biceps long head, and there is notable fluid accumulation within there. While viewing the histology of a tendon, here is a healthy one, for instance. This is classified as dense regular connective tissue, and so it has very regular and dense sheets of what is known as type 1 collagen. And so the purpose of type 1 collagen is to resist tensile forces, but only in one direction. It's also worth noting that the dark spots are actually fibroblasts that are creating this collagen matrix, but they are not, in fact, nuclei. If we look at the histology of a tendon with tendonitis, as shown here, it shows that the collagen is very disorganized and accumulated with what is known as neutrophils that predominate during acute inflammation. If we were to decipher this further, we would see macrophages and lymphocytes during what would be a chronic inflammation or a tendinosis if Josh's condition had progressed further than a month. Please continue to the video description to download the associated Anki deck, as well as go through and study the cards associated with video number 2. Thank you.